dealing with post-surgery pain. All the rest of it's gone. All the achiness, all the tenderness, everything else, all out of it. So she's agrees that it was 100% correct time to do it.
Wow, I got a friend that was an NFL football player, and he had one on one knee, and 2 weeks later had it on the other knee. I just like, wow. He used to play for the Lions. He was a fullback, Tom Nowatzki. Actually scored a Super Bowl touchdown for Baltimore.
Good morning, everyone. You're live.
Well, it's 8 o'clock. I don't recognize a clerk's member, though. Oh, there you are. Hi, Carrie Ann. I'm sorry.
Hi, that's okay. Just want to make sure you knew I was here.
Yeah, if you want to call the roll, go ahead. We can get started.
Sure will. Commissioner Bear,
Present.
Commissioner Wells, Commissioner
Present. Present.
Thank you. Commissioner Kennedy,
Present.
Commissioner Duckham,
Present.
Commissioner Pulaski,
Here.
Commissioner Mahoney.
Good morning, President.
Good morning. Commissioner Williams,
Present.
Commissioner Elwell,
Here.
Chairman Shotwell.
Here.
All present.
Okay. And do we have any public comment, Michelle?
Yes, we do.
Okay, go ahead.
Okay. Davida Quinn. Go ahead, Davida.
Hi, this is Davida. How are you all? Can you hear me?
Yes, we can hear you.
Okay, good. Today I wanted to just speak about the budget and about WIC and the importance of WIC to the Jackson community, to the families and the children. I have been working tirelessly ever since March dealing with the WIC program. Since it shut down, I have been working to feed the children of Jackson in the room of Partial to Girls. I, along with 7 other women, have taken on the role, basically, of WIC since it's been shut down. Before it got shut down, me as a grandmother, I have a grandchild that uses WIC every month. And without that WIC, the mother would not be able to feed that child. WIC is very much needed in this county. With the rates of the children and the mothers that's on social services, there's no way that we could get rid of WIC for Jackson County. The rates of the poverty in Jackson is staggering. There would be no other way to take care of this. So I'm asking you all, when you look at the budget, to please not cut the WIC program. It's imperative that we'll be able to feed our babies. Helping with the Partial to Girls have shown me that just with it being closed down for a little while, it has just been a tremendous need for milk. Girls and women are calling every day, I'm out of milk, I'm out of milk, I'm out of milk. If that program shut down, it would be devastating. You would have more children probably dead for malnutrition in this county than anything else, because the mothers can't feed those babies without WIC. Thank you.
That would be it for public comment.
Thank you. Entertain a motion to approve the August 4th meeting minutes.
So moved.
We have a motion by Phil Duckham, supported by Darius Williams. Any questions, comments, corrections? Seeing or hearing none, all in favor, please show the sign or say aye. You all set, Carrie Ann?
Sorry, all set.
Thank you. Next item is Health Department update.
Mr. Chairman, this agenda doesn't have the normal approval of the agenda item.
That's correct, sir, because this is study session. This is the Administrator Controller's meeting, not the County Board of Commissioners meeting, and I'm just helping him along here with his itemized agenda.
Okay. Well, based on the minutes that we just approved, which was a study session, item 4A was approval of agenda.
Are you making a motion to approve the agenda at this time?
Yes,
Okay, Tony Bear has made a motion to approve the agenda. Bill Duckham has supported it. Any questions, additions, or deletions to the agenda? Commissioner Bear?
I'd like to add a short discussion under other business of tree trimming.
Can we not direct that to the appropriate committee, sir, and talk about it next Tuesday when we have the professionals here to talk about it?
We can. I just wanted to let you know that I am drafting up a tree trimming policy that I will be asking the Board of Commissioners to adopt.
Have you reviewed the current procedures that we have at JDOT to do this?
Have not been able to find them anywhere on our board
They
docs.
wouldn't be available on websites, sir. They would be procedures, not a policy. So you'd have to ask the department staff and they would get with you and explain it to you.
I have not been able to find that on our website. It should be on our website. Any
And you've
citizen-
spoken to Christopher Bowl about this?
a year ago,
Okay,
and the same complaint came up from a constituent a week ago.
okay.
So nothing has changed in a year from our previous discussions.
Well, just because we don't do what a constituent wants, doesn't mean we're not following state procedures and guidelines.
But we were also not doing what I recommended either. So this time I intend to put it into a formal document and ask that it be adopted by the Board of Commissioners.
Okay,
Thank you.
Michael Overton, do you have a health update?
We do believe Rashmi's on the line. She'd like to give us a little update on the COVID-19.
Okay, good morning all. Thanks, Mike. Just to give you an update on what's happening with COVID-19 in Jackson County, our numbers as of yesterday were 804. 368 of those are male, 436 of those are female, and we have 39 deaths. On the statewide site, we've got 102,468 confirmed positives, and then 6,780 deaths. And then on the Henry Ford site, as of checking last week, they do this on a weekly update. They've got 3 individuals hospitalized at the hospital now. And then just a brief update, one of the things that we're working on right now is we've got an outbreak happening at our Henry Ford Allegiance Hospice Home. So we have about 9 cases there, some staff and some residents that are positive. So we're working up the outbreak there, working through getting Henry Ford to do some deep cleaning in there and recommending who needs to be off of work at this time and who needs to be tested. I think that's about it that I have to update at this point on COVID, unless anybody had any questions.
Okay, seeing and hearing no questions at this time, we'll move on to the budget. Rashmi, since I have you on the line, would you be so kind as to basically give the board the executive overview on the health department's budget, what changes you've made? Because clearly, we've had to reduce the budget, and it is a cause for concern for many people. So if you could explain what was reduced and what impact that will have, and how we are working to mitigate any negative impact.
Sure. So just to give an overview, as Mike mentioned, we were required to do some reductions in our budget for the health department in order to have our revenues meet our expenses, as well as to meet some of the indirect costs. So as a result of that, we had gone through each of our programs individually. There are, as you know, many of them, as you've seen in the PowerPoint, that are mandated. There's 8 services that are mandated across the state, or that we have to do as part of our state contractual obligations. So those are noted in that presentation that was provided to you. So we had, after looking at all of those, we had determined that there were some we were able to make some reductions on, some on a temporary basis, mainly because we believe we'll have to bring them back for COVID activities when we think that there'll be a second wave or things start to pick up here. So we did those reductions appropriately. They amounted to about $413,367.
Hey, Deborah.
And
No,
you'll see.
go ahead, Rash.
Oh, sorry, go ahead. So yeah, you'll see those in our presentation as we go through the PowerPoint. I don't know if at this time, if we wanted to start the PowerPoint, or you just wanted that brief overview at this point, Mike.
I see a number of questions. Phil?
Yes, I have a question on the mandated health department services. Are we doing these to meet the degree required, or are we exceeding the degree of service that we may have always been doing?
Sure. So for the mandated ones, we are meeting the contractual obligations for minimum program requirements as they're indicated in our contract and with our contractual obligations.
Thank you.
Mhm.
Mike, Daniel's got a question there.
Oh, I'm sorry, Daniel. I didn't see you.
That's okay.
By all means.
It's just a quick question. I'm just curious, the PowerPoint that Rashmi is referring to, because I don't see any PowerPoint from her in any of the attachments. So I'm not sure if I missed something, or maybe that was emailed out, or if that's going to be presented this morning to talk about those mandated services. So I definitely have some questions around what, how these cuts are going to affect those services that we do provide from the health department. But I'd like to get the full picture before I start asking questions, I guess.
The PowerPoint that she's referring to is the one that we sent out, was it last week? It was rather large. It explained all the departments. I assume everybody received it. What was it, last Monday, maybe a week ago? Well, did anybody get it? I assume you received it.
Mike, who sent it? You?
I did, yeah.
Okay.
Michelle, do you have it? Because if you do, we can pick it. We can pull it up, or we can send it to you and put it online and just go through it if they haven't seen that. It basically explained every these programs, what they do, kind of a brief overview, and then of course what the change was, explaining all that. And by looks on your faces, I'm thinking you haven't seen this. I'm sorry. I know that was kind of key. Okay, give us a minute here. Rashmi, can you email it to Michelle?
Mm-hmm. Yep.
I'm guessing it was attached to an email of August 21st. Does that sound right?
I think I sent it on Monday. Was it Friday or Monday? I don't quite remember, to be honest with you.
There's something attached to an email of August 21st.
Let me go. And you
And
can't
I must
open it?
admit that I didn't focus on it.
Yeah, that's the Friday update, which has the SRI information, and then there's a health department programs, 22 pages attached. I can send it out to everybody if you want by email, I think.
Well, you can, but unless they have multiple machines in front of them, they can't hardly look at it. Michelle's going to put it on and we can just pull it up on the screen and Rashmi can kind of talk us through it. Is that okay, Rashmi?
Yep, I'm just sending it right now to Michelle.
Great. Sorry, guys. So, but it did go through. It's not like it was so big that I was thinking maybe it got blocked by the size filter or something.
Sorry, it's taken a minute to download.
I sent it by email to commissioners that are able to view it. It's 22 pages.
Well, if you received it, everybody has it. It's in their email.
I don't see it. I don't have that from the 21st, and I did not get what Dave just sent either.
Oh, you didn't get it? Okay. Well, by all means, guys. Let's see.
Corey, it was the Friday update from Mike. It was buried in that. There were 3 attachments with it on the 21st.
So, all right. So maybe
I received that August 21st update, and it does have the 3 attachments.
The one on the far right, Tony.
Yeah, it's a full megabyte. It's a big file.
On my cell phone, they're vertical, they're not sideways. And yes, they all 3 are on there, and that's from the August 21st email.
Okay, I just sent it to Michelle. It might take a minute because it is kind of a large file, as Mike mentioned.
Yeah, it's too tiny to read on my cell phone. It's there, but great big magnifying glass.
Michelle's going to put it up on the screen so people can see it. And that way we can just kind of go through it and take questions. Rashmi can explain it. There it is. So Rashmi, if you'd talk us through, and Michelle will advance as necessary.
Sounds good. Okay.
Terrific.
So next slide, Michelle. Thanks. So essentially this first slide here is our organizational chart for the health department. It provides our 3 program service areas for health education and health promotion. I've also got these directors on the phone if you've got specific questions about the programs, if we want to get into any detail. And that area is overseen by Michelle White and houses all of our teen pregnancy programs, a WIC, hearing and vision, things like that. And then the second program there you'll see is our personal and preventative health. I've got our director on the phone as well, Matthew Budd, and that program encompasses all of our mother-baby programs and all of our clinical services. And then the third area that you'll see is our environmental health area, and Don Haydick's also on the phone. And we've got, those are the programs that are our inspection programs and permitting programs for like food, septic, water, that kind of thing. So that just gives you the layout of all of the staff we have here. You'll notice some of the program areas have coordinators assigned to them. And that's for the purposes of, for some of the programs, we have some state requirements that we are required to have a coordinator in those specific areas because they fulfill specific roles. For example, like our food coordinator, they don't necessarily supervise anyone, but they're responsible for plan review for our food program. So that includes here, you'll see as we have in the legend, we've also put all of our casuals that we have and split it out by the individuals we've got for contractors. And when we see contractors, those would include like our medical director, our early on program, because we have that as a contract with the intermediate school district, and those kind of programs. Our lab director is also a contractual position.
I have a question.
Sure.
I'm looking under Director of Environmental Health.
Mhm.
You have a director, then you have two coordinators, and they're each coordinating two people. Do we need
No, yeah.
that ratio?
Yep. And again, there is where I explained with the food coordinator, Commissioner Duckham, that we have to be required by the state to have a food coordinator so that they could oversee the plan review part. And then we have a field coordinator, and that person doesn't supervise anyone, but they oversee like the septic and water and, you know, the permitting programs and things like that there.
That's required by law. We couldn't have one guy supervise 4 sanitarians.
No, and they're not supervising individuals either. Everyone is supervised by our director of environmental health. So they're
right.
working as field sanitarians. They're not supervising people.
Thank you.
Well, if these supervisors are not supervising people, what are they doing?
So some of them, as I mentioned, like our food services coordinator is working as a, to do plan review. So it's required that they do that in addition to doing inspections as well as permitting and things like that. So that's one of the big areas that, you know, that makes the distinction between what they're doing and what the other staff is doing. Don, I've got you on the phone as well. I don't know if you want to speak to what the field coordinator does that makes it distinctively different, like as the coordinator piece. Are you able to answer to that?
Hopefully, please raise your hand if you hear me. Because I was kicked off just a minute or two ago, but I came back on. Can anybody hear me?
We can hear
I can
you.
hear you fine.
Yes.
Okay.
I put you as a panelist so you can
So
show
the-
your video if you need to.
Okay, well, okay. We'll see if that works. At any rate, my two coordinators, as Rashmi indicated, one for the food program and then one for the field services. Field services include well and septic, soil erosion for the main part, okay? And so Jason Bivens, the field coordinator, he basically coordinates all those activities. Does he directly supervise in the strict sense of the word? No, he does not. But that's the way it was set up, you know, however many years ago. And so, you know, his job essentially is to ensure that the permitting gets done, working with the front counter clerks, making sure the procedures are followed, also reporting to the state Eagle on a quarterly basis for our well and septic numbers that the state requires as part of our Eagle contract, and minimum program requirements, the MPRs through accreditation. So that then the food program, Matthew Horning, you know, we have 450 establishments plus or minus in any given year. The coordination of that program with the two food sanitarians to do the inspections twice a year for most restaurants, STFUs, which are your food trucks, and temporary food events, which we've had very few this year for obvious reasons. Any questions? Did anybody hear that?
Yeah, we heard you, Don.
Okay.
We'll, if anyone has any questions, now would be a good time. If not, Don, just down the line, we'll have questions as they come up.
Mike, I have a
Rashmi?
comment.
Oh,
Mike?
Phil does.
Yeah.
Go ahead, Phil.
This still looks to me like it doesn't look like private business will be set up. It looks to me like there's a belt tightening move that could be made there. As an example, I just, like I say, Don explained it. I see what he says, but I just feel we got too many specialized people that do just specific things where they ought to know both. I mean, one guy ought to be able to coordinate for 4 people. I mean, I don't know what he does after he coordinates 2 people's schedules. It just seems to me like there's some belt tightening to do there. That's my only comment. And respectfully, Don and Rashmi, you're there, you know it. I'm from private sector. And it just looks to me like there's money to be saved there. But
Well-
respectfully, I listen.
Don, Rashmi, Don, elaborate there a little
If I
more.
may
I mean,
respond.
I understand what Phil's suggesting.
Yeah.
I think he's saying, hey, you just need one coordinator, but aren't those people actually still yet working out in the field, doing the job day in, day out? They're not just saying, hey, I've coordinated, I'm good for the
Yeah.
day.
Right. They are,
That
Mike.
is-
Go ahead, Don.
Okay. Yes, they are. Jason, when we had a second field sanitarian, between the two of them, they were splitting, the county in half, and the 225 to 250 well and septic inspections each, across the board, basically splitting it 50-50. Greg, when I had him, did the septic truck inspections. They both did soil erosion inspections in their respective townships. So, when they're not just Jason's as a coordinator, his job is to ensure that the minimum program requirements are fulfilled, but he is out in the field every single day doing inspections, doing perk tests, doing well inspections, issuing the permits. Matthew on the other side of the fence for food is also doing the same thing. He's ensuring that all the minimum program requirements are followed, but he's also out in the field doing restaurant inspections, STFUs, the major majority of the plan reviews. So they're call it a working coordinator, but I would say the coordination is probably 10%, 5 to 10% of their time at most, if you want to look at true coordination activities.
Okay, well, it doesn't, you just figure numbers. You say 250 inspections, that's 5 a week. If you divide it up
5 a week.
simplistically and equal. When you started the conversation, you said 250 inspections they do. And that's 5 a week. That's 1 a day, really, if you break it all the numbers down. But I'm just going to be watching, okay? Looking for opportunities here. I'm not going to try to run your department. So thank you for your answer.
Well,
Thank you, Phil.
I would like to elaborate because we have been working with 5 sanitarians since the end of July and one and 1.6 clerks since
You're talking about last year.
October 1. And I'm sure you have probably heard from contractors, maybe some of the general public, maybe some of your constituents, what used to be about a 1 week turnaround on permits, we are now at about 4 or 5 weeks. And we're in our busy period of the time, which will continue until the snow flies. So those are the facts on the ground. And I just want to make sure that you are aware of that. There are consequences to understaffing.
Thank you. Other questions, or shall we?
Yeah,
move
why
on?
are the inspections taking 4 times as long to get done?
I just explained that, Commissioner Bear. We've been working with 5 sanitarians instead of our normal 6. Our workload has not changed. Our soil erosion workload has increased somewhat because of an audit last fall. And I have less staff, and in both at the clerking level for processing as well as in the field. And when you have less staff, you have greater delays in getting to all the work. That's the fact of the matter.
Well, if the time frame quadrupled, that's not consistent with going from 6 staff down to 5.
Well, that's not a true mathematical model. It's not a linear process. I don't know what to tell you on that one. The fact of the matter is there's only so many hours in the day, and it takes time to do a perk test, takes time to do an inspection, takes time to do the paperwork, and it takes time to issue the permits.
Okay. Hi, Don. Commissioner Kennedy here. How you doing?
Great, great.
Just for clarity's sake, because I heard Commissioner Duckham say 250 permit requests a year. Is that accurate?
Okay, about 250 well permits on average over the last several years have been issued, and 225 plus or minus. Sometimes it got up to about 240, 250 for well or for septic permits. So both programs are running 225 to 250 on average. To date, I ran numbers yesterday, as a matter of fact, from January 1. And we have issued 189 septic permits and 184 well permits, and since January 1. Right now, I actually do have some of my food sanitarians over the past several months helping out, doing septic inspections. I've got, as well as in soil erosion inspections, because I got additional staff. My food sanitarians doing some of that. We're spreading the load the best we can, but the delays have increased. And again, it's a function of number of available hours to put into the various procedures and processes and inspections and what have you.
Okay. I was just looking for clarity on the amount of permits. That's all. Thanks, Don.
Okay.
Thank you. Then Rashmi, you may continue, please.
Sure, thank you. If we can move to the next slide then. The first program that you'll see here is our emergency preparedness. It's a non-mandated program. We do receive state money for it. What the individual does is they provide our pandemic preparedness plans or mass vaccination plans, provide trainings for staff, or secure that, there's other trainings going on regionally that they can participate in. The other part is they do the public information officer duties, meaning that they create a lot of the documents that we put out for the media. We are proposing here a reduction in the position. We've got more than one FTE working in this program right now when you add in the public information officer duties. So we're proposing to bring this down to one FTE, which is the required amount of staffing that we need for this position. So as I mentioned, it's a non-mandated program. However, since we do get state money, the state does indicate how many staffing we should have for providing this in our county. So we're eliminating the public information officer duties and going to absorb those under the coordinator of the emergency preparedness, and that's going to be the reduction there. Any questions on that one?
I had a question, Rashmi, just for clarification for the board there. You said it's non-mandated, which implies it's not required, but then you said it was required.
Sure. Yeah. So the distinction there, Mike, is that it is a non-mandated program. It's not like a required service that we have to provide. However, we are required to assure that our staff are properly trained when events such as COVID or other types of public health emergencies happen. We are required to have a certain amount of plans in place, such as our pandemic preparedness plan, mass vaccination plan, things like that. So those are definitely pieces that are required for us to include and have as part of our indicating that we have an emergency preparedness, like fully functioning, operation here.
Okay, questions, anyone?
Yes, Rashmi, this is Tony Bear. On this page, the third bullet point, what expenses, how many FTEs would need to be eliminated? By eliminating 1/4 full-time employee,
right?
That reduces the deficit from 33,000 down to 8,000.
Yes.
So we've got a full-time equivalent is $25,000 a year.
We have more than a full-time equivalent in this position, in this program. We end up having, let's see, if you look at the PowerPoint before, We've got, let's see, how many FTEs we've got there, 1.25 FTEs. So on the 0.25 is the person that does the public information officer duties and things like that. So what I'm proposing here is that that person would no longer do those duties and they would be absorbed by the 1 FTE that we have.
All right, then I'm confused with the wording. It says by eliminating 1/4 FTE, that reduces the deficit by $25,000. That means that
No,
person's
reduce-
getting paid $100,000 a year?
No, this is out of our total operating budget within that program. So that reduces it by 33,690 by taking that position out.
All right, the math just doesn't work for me. A 1/4 time employee reduces 25,000.
Tony, there's other things in there besides just the FTE associated with an employee, especially one of this caliber. I know who this person is. You know, but just
this
take their word for it. Take their word
explain-
for it. Take their word for it when they tell you it's 25,000.
All right, take my word for it. This bullet point does not explain it very well.
Oh, thank you. Moving on, unless someone else has a question about that. Okay, Rashmi, go ahead.
Okay. We can move on to the next program then. Next slide. The next one is our immunization program. This is required per the state contract. We get state funding to provide this program. And this is the one that we do immunizations for all of our kiddos all throughout the community. You'll see here the minimum program requirements. It is for the pediatric populations as well as susceptible populations. So we do our flu shots each year that we offer to county employees. We also do community flu shots, things like that. And then the second bullet is you'll see what's required as per the Michigan Childhood Immunization Registry, where we track like how, who gets immunized and that they're keeping on schedule, things like that. So, and this is the schedule that's required, and we're required to immunize at least 72% of that population within that age group to complete that series that you'll see indicated here. Then you'll also see in the third bullet, the various other immunizations that are required under that age group. Those are the other, that are required as per this schedule. Then you'll also see the adult immunization coverages that we need to fulfill within that age group, the 156 months, but not yet 216 months. And those are the other immunizations that are required per the adolescent age group. Next slide, please. So you'll see here that we're eliminating, what we're proposing to do is eliminating 1 day per week for the clinic schedule. We typically operate on a normal year. Right now we're doing 2 days a week because of COVID, but we would probably eliminate it we would eliminate a day of clinic. And by doing that, it's going to reduce our deficit by how much you see here. To 199,482. So again, we are still required to do this program. The other key piece of this program is that the nurses working in this area are ones that are also assisting right now with COVID response, and then they would be also providing immunizations in our clinics that take place right now. And then they will also be doing the COVID vaccinations when those become available. Any questions about this program?
This
So,
is Earl. I'm sorry. Did someone else want to talk?
No, sorry about that, Earl. Go ahead.
Okay, I was, I appreciate the effort here to save money, and that's good. Except that, and I'm going to just toss something out here for your comment, Rashmi. At the very moment when an immunization for COVID may arise, we may find ourselves shorthanded by virtue of not having resources available to implement them.
Mhm.
I guess I would ask your opinion if some vaccine presents itself,
Mhm.
what may be necessary in your office to ramp up and take care of 160,000 population county?
Sure. Well, I appreciate the question, Commissioner Pulaski, and I think we're having discussions here at our staff level. There'll be a time in the future that I'll be coming to you. We're getting some COVID money from the state. And it's likely we are going to have to increase our nursing staff by at least 1.5 at this point. We've got a part-time position that we may need to bring up to a full-time. The other thing that we're looking up as backup plans is potentially using the universities. They've got some nursing programs, the colleges, they've got some nursing programs that we might be able to pull from some of their staff there. And the other option is that there's also a group called the Visiting Nurses Association, and that it might be an opportunity to contract with them and be able to get some nursing services through them as well. The other option is Henry Ford, but this was before COVID really started to pick up. They were able to, they offered to assist us by providing some nurses. But again, I don't know, depending on what COVID looks like at that time, it may not be a group that we can necessarily rely on for Henry Ford. So.
I guess what I'm hearing you say is that if a vaccine presents itself and we're prepared to implement it, resources, you're thinking resources may be available both in terms of money and staffing to get it done at that point, even if we were to make the changes you've suggested here.
I think so. I think Commissioner Pulaski, with some of those backup plans, if we can utilize some nursing staff in other areas in addition to the health department, I think we should be able to do that and make plans there.
Okay, thank you.
If I may too, just add on to that, that's one of the issues we've been discussing with the health department is, because Rashmi has said more than once, we don't know where COVID is going to be, a month from now or 6 months from now. And if we cut ourselves too short, we won't have the staff available. And it's a sticky one because, we don't have the money just to hold on to people unless we can currently utilize them. So it's a struggle for sure that we need to be planning for those outside resources to supplement what we can do internally. I believe, Daniel, you had a question?
Yeah, thank you, Mike. I did have a quick question. I was just looking at the program impact of making this reduction in the area of immunizations. Do you have any idea of level of service reduction that we'd be able to offer, or does this just mean fewer workers with more to do? Is I guess what I'm curious about, because I see that, of course, the your statement on what it impacts, but I'm curious how it impacts the community itself, and if we're going to be able to provide less services for the people of the community.
Right. So that's a great question, Commissioner Mahoney. And really, it does end up to less people doing the same amount of work because, we're still going to be meeting those immunization requirements that we are required to do. And it's going to be a challenge, I will admit, this year because we're already behind because of COVID. So to meet those percentages of those kiddos that need to be immunized, we're going to be playing a lot of catch up here in the next several months. But really, it's going to come down to the same amount of people. It's going to be, one less day of clinic. So it's going to be, some hours reduced there in terms of probably the person working in that clinic area. But, we're going to still be immunizing the same number of kids and trying to keep those levels up.
Mike?
One follow-up question, if I could, Rashmi, and I don't know if you would have an answer or not, but I'm curious if you've considered or thought about the impact that this will have, this increase of responsibility and work for the employees that would be left. Have you considered what type of impact that's going to have on them, or stresses that's going to cause on them to perform and do their job?
Yeah, I will say, Commissioner Mahoney, that, our staff has been working tremendously hard, particularly on the COVID response. So yeah, it has, it's caused a lot of, if you will, challenges with morale and people, keeping up their spirits and things like that. But it's, I know that they know that it's work that has to continue as part of our public health service. So I appreciate you raising that issue, but, it's still, this is still one of the mandated programs and still one that's critical to our community. We do know some providers, provide vaccine, but there's quite a bit that don't carry vaccine, and, we end up becoming the safety net for a lot of the community as well.
Okay, thank you. That's all the questions I have for right now.
If I may, Mike,
Please.
Rashmi, thank you for the presentation and all your hard work and everything that's going on. I know you're in a tough spot. When we deal with immunizations, where are our health partners, Center for Family Health, the other programs? Have we reached out to the Medical Assistants Association? Have we reached out to the different pharmacies that do flu vaccines and other vaccines that now I see they're advertising to help create our network? So when we do get ready to ramp up, we've had conversations with these people and we planned accordingly. I hope that there's a behind the scenes network that we're working on. I know that was my experience with swine flu, being a youngster at the time, but I did have a family that was very involved in healthcare, with an aunt who was past president of the State Medical Assistants Association, and the ramp up for that and the involvement of different areas set up to make sure we had the whole community vaccinated when the opportunity presented itself.
Sure.
I'm just curious if there is that kind of network, and if there isn't, is it something that you think you and your staff could possibly put together for us?
Sure. So, and that's a great point, Commissioner Shotwell, because, right now, a lot of those places that you mentioned, like the pharmacies and stuff, are carrying the seasonal vaccine. And in our preparedness plan that I mentioned before, in emergency preparedness, a lot of those plans include working with those other providers when COVID vaccine becomes available, in such that we may not be the only ones vaccinating the entire county, but there's going to be others working in concert with us to be able to accomplish that. So Center for Family Health surely will be one of the providers. Henry Ford Allegiance Health, we've already started having discussions with them when the vaccine becomes available, that, they are also getting their staff at the very least vaccinated, but then trying to help us in terms of determining, how can they help with the community piece on that. So we do already have a lot of those discussions and a lot of those plans laid out in our mass preparedness plans and our mass vaccination plans.
Thank you, Rashmi.
Yep.
Any other questions in regard to immunizations? Okay, Rashmi, next slide, please.
Next slide. The next slide is our immunization action plan. So this is related to our immunization program. The reduction in there is about 11,955, but it is mandated and we are required to provide this plan. Part of it is, as we had just talked about in those questions, about how do we assure that there's providers available and that they're keeping vaccines safe and that they're, offering clinics readily to the community, things like that. We're required to submit a plan to the state as part of that. So unfortunately, we weren't able to make any reductions here because really it's just about a person that already is working in the immunization program, doing other activities, that their key role is also to develop this plan and to provide that to the state. That's one of our requirements here.
Thank you. If there's no questions, we'll move on to the next slide.
Okay, next slide, please. Our next program is our sexually transmitted diseases clinic. So this one is also a mandated program that we're required to provide as per the state. You'll see here that we do a number of tests for syphilis, gonorrhea, chlamydia, HIV. We also do screening and surveillance of these diseases to assure that individuals are appropriately treated, as well as trying to keep our disease rates down in our community. So a lot of it is about prevention measures and what can we do to try to reduce that level here. And then what we're proposing to do here is to reduce our clinic to 1 day a week as well, so that we're still going to have to meet the services in terms of individuals that require testing, treatment, things like that, because we are required to still make sure that they are treated, so they wouldn't there wouldn't be long-term health consequences of this. So that is what we're proposing here. As you can see here, our rates of gonorrhea and chlamydia are listed here from 2018 to 2019. They have gone down slightly, but except for gonorrhea, it's gone up a little bit. So just to give you an example of what our cases look like there. Any questions in regards to this one? Okay, we can move on to the next slide, please. Our next program is our hearing and vision program. This one is also required as per the state. It is a mandated program. We screen about 18,000 kids a year in the schools, and they're provided pre-K through all the way through 9th grade. And so we look for, obviously we try to identify issues early on so that individuals could be referred to specialists if needed. Also try to deter if children are experiencing some delays in learning and things like that, or is that really what they're experiencing, or is there vision issues occurring, things like that. So we have a couple staff. Most of our staff here work part-time because they might be working in other program areas as well. So we're looking to put 2 individuals who are on a part-time basis right now on furlough to reduce that deficit here. So again, we are required to do that program. So our rates right now, we're challenged with getting into the schools and trying to keep those rates up of kiddos that we screen, given that some schools are closed. But we hope that that will pick up here again as the schools open up, or as we, hopefully get back to some level of a normal status going into next year. Any questions on this one? We are required, I also want to mention that we are required to do a 50% local match on this as per the state contract. So that amounts to about $89,000. Any other questions here? Okay.
Next slide, please.
Next one is our Medicaid outreach and advocacy. So this is a program that is kind of spread throughout several of our program areas, and it's not really a service so much as, well, it is a service in that it's individuals that are helping people to sign up for Medicaid, know what resources are out there, things like that. So we've got people who are working in hearing and vision, communicable disease immunizations, MIHP, our maternal infant health program, sexually transmitted diseases, and they essentially are providing that service of the outreach and making sure that individuals are signed up for Medicaid appropriately. So it brings in revenue to our program essentially because we're hoping that individuals get signed up and it helps to support those program areas by those individuals doing that work. So there's really no reductions that are being made here. Any questions on this? Okay.
Next slide. Don't be shy, guys.
Okay. Here's the fun one. I think that we'll probably get into some discussions here. This is our Women, Infants, and Children program. So as I had may have mentioned earlier, if I hadn't yet, it is a non-mandated program. However, I will specify that under the public health code, we're required to assure that someone in our community is providing the service if it's not us. So we've been doing it for about 40 plus years at the health department. And it's worked wonderfully well. This is one of the program areas, I think even our staff has exceeded the number of clients that are being served, which has been a wonderful thing. We've continued to service clients even through the COVID outbreak on a remote basis. We are looking to reduce the staff there by placing them on a furlough. So it's going to be either, you know, we're not sure here yet if it's going to be a clerk or potentially some positions that we have that also help to support the program here. So that's the amount of reduction that we're proposing here. And putting that
Rashmi,
on furlough.
Rashmi, could you explain the furlough portion? Because furlough implies, in my mind, temporary, and
It
we're
is.
looking for sustainable reductions. But so how does
Right.
that all figure?
Sure, thanks, Mike. So furlough, the reason we went with the furlough option on this furlough is a temporary reduction, as Mike had mentioned. What we hope to do is that if there's revenue to come in to help support that program, which we anticipate likely with COVID money, is that we could bring this individual back, like helping to assist in some areas like that. So furlough is a temporary option here, but again, we would not bring them back unless there was revenue to support them.
Questions, anyone further?
Yes, I have
Rashmi?
a question.
Sure.
Rashmi, these,
Yes.
how are these WIC funds normally distributed so they get to the people in need? And how has that been affected by COVID and the shutdown?
Sure. So the way we get our WIC money is we get it for a certain number of clients. We have like what we currently get from the state is for 4,277 clients is what the state gives us an allocated funding amount for. And in COVID, what we've been doing, because the clinics have been shut down, is that individuals have been coming to the health department. If they're not able to pick up their benefits online or things like that, they're coming into the health department. We're meeting them outside actually, you know, and giving them their benefits card, you know, giving some information about how the program works, things like that. But if we were running like a normal clinic, usually we do lead testing, we give them information on nutrition, education, breastfeeding, you know, there's a whole host of other educational pieces that we do, as well as like services, you know, when we talk about some blood tests and things like that, that we would do as part of the normal clinic that aren't occurring right now. We have that waiver, though state has gotten a waiver to be able to do those services remotely now, and that waiver goes through the end of September. However, if things open up or they're not able to get that waiver extended, that waiver has to come from Congress. Then, you know, that might open things up again October 1. But that's all yet to be determined right now.
So the result is that based on your department's activities, the cards have been getting to the people. So the money that they needed to purchase food, home supplies, that has been getting to them. And so the service has not been interrupted financially.
It hasn't been, no, they should still be able to get their resources that they need. It's just that we're not able to offer up the full clinic and offer the, you know, level of the face-to-face services and things like that, but they should still be able to get their benefits.
Okay, then the one comment made during public comments that somebody else has been graciously picking up the slack and getting the people taken care of. How does that reconcile with what you have been doing, that you've still been getting the financial contribution to the people in need?
So some individuals have had a hard time getting their benefits online, I think. So that's why we've opened up our doors to be able to get people their cards, their bridge cards, and, you know, help them understand like what they need to do and things like that. So we've still been able to keep our doors open to be able to explain that to some folks. But, you know, I don't know for certain, like maybe they had some problems on the electronic system to get that. I don't know, you know, if that was the issue. And without talking to them in detail, you know, it'd be hard to say for sure.
All right, thank you. It's good we have people in the community trying to fill any gaps there.
Rashmi, just to be clear, so we're with this current slide you're on here, we're not cutting the programs, we're just cutting staff temporarily. Is this correct?
Yeah, so we're looking to temporarily reduce that staff at this point. However, one of the things is if we continue to make some reductions here, I will say one of the consequences could be people are put on a wait list. And then that delays services even longer. I think one of the requirements that we have for WIC is that we've got to get people enrolled like within a 10-day time frame for new clients, and then a 20-day time frame for clients that have been on the program before. So if we end up having like a reduction in more staff or, you know, something like that, there's the potential of things being delayed and individuals getting on a wait list, which could cause some issues there.
Okay. And this is more of a question looking along the lines of 2021 and 22 and beyond. With a lot of the reductions that we're making all across the board as it relates to the health department, would we be able to receive any potential grants or anything from the state or federal to allow some of those missing pieces to come back online?
So, yeah, I mean, there could be the opportunity, I suppose, to look for grants. Commissioner Williams, I think that's a great point. However, sometimes it's really challenging to find those grants that can cover all of our costs. You know, when we talk about indirects and all of that kind of stuff. So that's where we want to be sure if we're going for a grant that it really is able to cover all of our costs as much as we can. You know, and you'll see in some of our other programs later for like abstinence and things like that, you know, we have gone out for some grants and some additional funding like through United Way, things like that. But it just becomes challenging when we go for those that we go out for something that can really help to cover all of those costs.
Okay. Okay. Thank you. I have nothing further. Thank you.
Other questions? Anyone?
Yeah, please.
Corey?
For individuals that are first-time people, confused, don't have the information of how to get onto WIC, is the county their only resource, or is there a state hotline they can call and get guided through the process as well?
I don't, I'm not aware of a state hotline, but I think, you know, we can definitely get individuals hooked into the program. I'm going to let Michelle speak on this too. Michelle White is our program coordinator who oversees the WIC program. Michelle, are you aware of any kind of hotline or information that individuals can go to if we're not able to help them?
I'm sorry, I kind of missed the original question. Good morning, commissioners and Commissioner Kennedy. I wanted to go back a couple of questions ago, even from Commissioner Bear. And so Commissioner Kennedy, if you could repeat your question, and then I have a couple other additional points I'd like to make.
Sure. Okay, my question was, if an individual was, let's say, a first time in need and you know, they're clueless as to where to go to get established and get set up for WIC, is the county their only resource, or is there something available to them through the state, that being an office, a hotline, anything of that nature, where they could get guided through the process?
Guided through the process of how to enroll in WIC?
Yes.
Yes, we have many referral services that come our way. We received daily from the Michigan Department of Health and Human Services, and we're part of a whole network system of receiving referrals. And we honestly receive hundreds of phone calls. So they do start to enroll through, you know, talking to someone right now on the phone because of COVID especially, but we have multiple referral areas that come through WIC, and there's many hand-holding that happens through local health system, and our if clients receive food benefits through the state, which is different than WIC. So yes, and if I could also clarify a few other things as well. Commissioner Bear, the number of clients that we've been able to see because of COVID. So you have to understand normally that clients have to come in person every so often and receive education in person, and then the hemoglobins and leads, and normally that takes a lot longer. Since COVID, we've been doing all of our services remotely. If a client does need to get a benefit card, and I do want to remind you, this is a supplemental food program. It's not meant to provide 100% of the need. It's a supplemental nutrition services program. But we do go out and we, you know, give them a card out in the parking lot and things like that. Our numbers are higher than they've been in the past 10 years because of being able to do remote services. Our caseload, normally we're at about a 79–80% rate of the numbers that we're able to meet. We are currently over 101%. We had a call with the state WIC director last week. We are one of the highest in the state for being over our numbers. Just since March, we've added 638 new clients to WIC. And we do work in partnership with the Partial to Girls program. So we have close relationships with them. One of our staff that has been furloughed, just because of the remote work, we've been able to do without one full-time clerk. And that's simply because we're able to, serve so many people over the phone. When you're in person, it takes much longer when you have the leads and hemoglobins and, but that one person does work with the Partial to Girls organization. When we receive formula donated back to us, we do give it to Partial to Girls. We've received some grant money from local Rotary, but we're not able to technically receive that through WIC. So we gave that directly, $2,000 worth of formula to the Partial to Girls organization. So we do have a very creative partnership so that we're able to help as many families as possible. Right now, it's 4,500 clients, that's pregnant and postpartum mothers and children under age 4. So our numbers are higher than they've been in 10 years. So I wanna make that clear. Because of COVID, our work has actually been easier because of the remote services that we're able to provide. Once we are mandated to do our services in person, we are concerned about the time involved with disinfecting between each client. And we have had, mothers and children that haven't had hemoglobins and leads done since before March. And so we're afraid that we may only be able to see 50% of what we're seeing now because of the time involved. And our caseload numbers, there's a formula the state uses to give us our revenue. Right now, our revenue is $876,695 based on a caseload of roughly 4,200. And with us being at 4,500, we're over that, but it takes some time for that to result in additional revenue. We also do receive $10,000 in revenue back from Medicaid reimbursement. The average indirect rate in the state is between 30 to 35%. Ours is currently 45%. So the budget right now, 328,000 would be coming back for indirect. And there is no local match required for this. And the state does not put a cap on indirect. So that's kind of affecting our budget a little bit as well. But
Okay, thank you, Michelle. Do
questions?
we have any other further questions? Okay.
Yes, I'm sorry. I've got a couple questions, or really, and I'm sorry. My questions can probably wait because I'm more interested in the next slide, which talks about the impacts of this program, which I know we've kind of already been diving into the impacts, but I'm really interested in hearing some of the impacts and potential decreases in services if we have this severe of a cut to this program. I mean, I know that we are in some dire situations right now, but it, as a father and family who has utilized the WIC program personally, I can tell you that supplemental nutrition that they offer and the services that they offer are critical for the survival of our families. And we've got, like they just said, almost 5,000 mothers and children out there who are utilizing these services right now. And I'm really, really concerned that with this big of a cut to this program, what that's going to mean for the services that these families receive. So I'd like to really hear some about the impact of these reductions.
Rashmi, could I,
Sure.
David Elwalt, David Elwell, can I ask one question on that slide, Rashmi, before you change it?
Uh-huh.
You've got on one of the bullet points, under the minimum program requirements that we need to assure that it's offered. It doesn't necessarily have to be the health department. And if we don't, we need to assure another entity provides the service. Are there any other counties in Michigan that have WIC provided through another entity that we know of?
The only one I know of offhand, because I worked in that county, was in Allegan County. Our federally qualified health center did it there. But yeah, there are some throughout the state that it's offered either through their federally qualified health center or some kind of, community action group of a nonprofit or something like that. But
And in those, the programs are entirely run that way, the WIC program?
yeah, it's like the state gives their allocation that they would likely give the health department, they give it to those organizations.
Okay, thank you.
Okay, next slide is the one that Commissioner Mahoney had mentioned that does talk about the program impact here. And so obviously, as you'll see here, these are some of the impacts that the program brings. It does provide, as Michelle mentioned, the supplemental nutrition program, as well as the education on feeding practices for like breastfeeding, things like that, how to obtain your food-related benefits, and then as we see, these could be some of the long-term impacts of if we had to make further reductions in this program. A lot of these relate to nutritional issues that could occur on a long-term basis. The other thing that I mentioned earlier was the whole piece of, people being put on a wait list. Michelle also mentioned the issue of, as we open up our services, it's definitely, which is what we're doing right now with a lot of our clinics, is we're making sure that, things are cleaned in between clients. It's definitely taking longer than it takes to see a client on a normal basis. But those are steps we would definitely have to take to assure that clients are protected. And then one of the notes that we make here is that it does provide an economic impact to the community. It equates to about a $2.48 return on every dollar spent, which is a figure that the state does on return on investment for WIC. So these are individuals then we can assure that they're, getting the proper nutrition, getting the services that they need, things like that. So the other piece that you'll see here noted too is that it brings in dollars to our local grocery vendors in WIC benefits alone. And in 2019, it was able to bring in little over $2 million just to our vendors who are providing those nutritional services, nutritional foods, in their community grocery stores. So is there any questions on this specifically?
Yeah, I have one. Commissioner Kennedy, how are you doing?
Good.
First bullet point, it says families will not receive nutritious food. But I thought we already established that there's not going to be any type of reduction to people's balances on their cards. So why is that even noted?
I think it's, really what it is it's a supplemental program so that people can go into their communities and get what they need to. So, we want to ensure that people can get those cards as much as possible. As I mentioned earlier, I think people have been experiencing some challenges, probably not unlike those who are experiencing the challenges with the unemployment system, being able to get in, get their cards, get their benefits, things like that. And so there might be like somewhat of a delay in some of that. As Michelle mentioned, and as I had mentioned, we're in this remote piece, we're also bringing, trying to have people come into the health department so that we can give them their supplemental card, and make sure that they're getting that. But there could be the potential that there's that gap if they're not able to get their benefits electronically.
Well, I would highly recommend that some individual puts either on our county website or some source of information that the public could see those other options that Michelle mentioned when I asked the question about state agencies, or it sounded like, did you say in Allegan County, a federal agency actually out?
It's their federally qualified health center, InterCare, that does that there.
I mean, I think the more resources we can give people, the better if we're going to have a reduction in staff. That's just my suggestion.
Yep, that's a great idea, and we'll look to make sure that those resources are put out there.
Rashmi, this is Michelle. Could I add also about the program impact and what Commissioner Kennedy is mentioning about the bullet point here? It probably should be revised to say fewer families will receive nutritionist food, because I will be honest, right now, the way WIC is operating remotely, our staff are doing a fabulous job, and we're able to serve more clients in this format than in person. And so even if this were to continue until the end of the year, that would be the case, even with one clerical position that would be cut. Once we get the go-ahead from the state that we need to be in person and back up and running how we were, even with one less clerical staff, and that's roughly $52,000 a year with benefits, and I think that's the full cost of a clerical staff person, it will directly impact the number of families that we're able to serve, even with one less staff. And ultimately, the fear, even our state WIC director had mentioned this, the fear is that even by reducing our caseload, it will eventually turn into a cycle of reducing the revenue that we receive from the state. So we will not be able to see the numbers that we are doing remote services. You're not going to keep seeing these numbers from WIC. And even with one less staff person, we're not going to be able to serve 4,500 pregnant and postpartum women and children. It might be 4,100. I'm just giving an example, and that ultimately affects our funding formula. And then we'll have to cut more staff. So we're just concerned, and the state is concerned as well, that it will turn into a cycle of less revenue because of the number of families. Even if we're 300 less than what we may see right now, it will result in less funding from the state is their concern.
Okay.
If I may chime in there, just Rashmi, Michelle, if I heard you correctly, and perhaps I did not, you suggested that you're more efficient working remotely, and I guess that begs the question of why can't we continue to work remotely, and for some cases, if it's more efficient and cost effective?
Yes, thank you, Mike. So we have to do what the state and the USDA mandates. And so everyone in the state is, relying on that decision. But there are, we're doing our services over the phone. And I will be very honest, it is more convenient for our clients. Having to pack up a family with small children, a newborn baby, foster children, it can be cumbersome, even if every 6 months they have to come into the WIC clinic. So that can be a barrier. And so that has been removed. And normally that is a requirement of our program. However, the area that's missing is the hemoglobins and the iron and the lead testing. None of that is happening. And they, the pregnant women and the children do get their fingers poked. So none of those services are happening. So it has removed a barrier, I will say, and transportation, we always try to help with that, but it's easier to do services over the phone. We are at the mercy of what, the state WIC and USDA allows us to do. However, we are missing the hemoglobins and leads as well. And
Okay.
some face-to-face education.
Thank you, Michelle.
Yes.
If there's no more questions, we can
I
continue.
have one question.
Go right ahead, please.
Michelle, the over 4,000 people that you are providing service to now, once the governor's restrictions are removed and people can go back to work and they'll have their regular income coming in, how many people do you anticipate will no longer need to rely on WIC to support their families? Because they can, now that they're working, they can support their families themselves. So you have a certain number of people that you are serving now, how many, have you estimated how many people you'll be serving after people are allowed to go back to work?
Commissioner, that's a great question. All I can estimate is that, our caseload, the way our funding formula currently is based on that we would see 4,200 clients per year. And that's how it equates to the 876 and a little bit more revenue. Since COVID and since we've been doing remote services, we've had, and unemployment and the income of so many families being impacted, we've seen additionally 638 clients. That includes the mothers and children. It's hard to say, but I would say, right now we're seeing about our average, has been higher than that 4,200. So by, that many, so I would hope at least we'd be able to go back to that 4,200, which is based on what our revenue is. It is sad what's happened, financially to so many families because of COVID. And that definitely does, increase the need for WIC. It takes time for that to increase our revenue. I will tell you, our state WIC coordinator, our local WIC coordinator, Stephanie Horning, did ask about, because we're at 101% participation right now, if that would eventually, sooner than later, turn into more revenue coming to our program. And they said not at this time. It takes, I don't know the exact amount of time, but for the state to give more revenue based on the families that we're serving. I'll be honest with you, I wish that we could do a hybrid model when this opens up. I wish that we could do 50-50 remote. And I think we've learned a lot from doing WIC services, over the phone. And our dietitians and nutritionists and our clerks have done a fabulous job with this. I wish the state would allow us to do a little bit 50-50, to still see people in person. I think that would be a great model, but it's a guess as to how many less people. I think it's going to take time. I think the economic effects from COVID, we're going to be seeing those for a long time. So I know I've just kind of explained a lot of things, but I think the need's going to be there for quite a long time.
All right, thank you, Michelle.
Yes.
All right. Next slide, please.
Sorry, I just had
Neil
one
has a
more.
question.
I just had one more comment on this before you leave this slide, just to kind of bring some more context to the situation. I guess I'm going to get a little bit more personal again, because like I said, my family is one that utilizes these services. I've not been unemployed since I turned an adult, and probably since before that. So I don't think the problem, Tony, is that individuals aren't working, or when they return to work, or if they're allowed to return to work, all the problems will be solved, and then they'll be able to afford to feed their families and properly give their children nutrition. The problem is being underemployed, which so many in our community are underemployed. So this WIC program serves as a supplement for those who are underemployed. And I have a high concern about the wait times and our ability to handle being at 110% of capacity when they're going to go back to actually seeing people in person. Those appointments take anywhere from 15 to 45 minutes, sometimes an hour. And as a father with multiple children, I can tell you how stressful it is to have to bring a child into the WIC office. And I mean, this is a social service. So as much as we want to be judgmental because we're trying to find where we can save dollars at, this isn't the time for that. I think that we have to look at this for what it is and really realize what impact we're potentially going to have on the most vulnerable in our community, the most vulnerable in our community that we should be doing any and everything to take care of. And I think that this is a critical program, and the concerns that they have about these cuts and what they mean long term are something that we really, really need to consider. What the long-term impact is going to be, because from my standpoint, it sounds like we're going to put ourselves in position to make a cut to this program now, and then because of a reduction of staff and a reduction in the ability to provide services, we're going to serve less families, which in the long run is going to mean less money coming into that program, which means eventually we're going to be right back at this table again, potentially making another cut to this program. So I just have some very high concerns about what we're doing with cutting this program and funding for this program. I just wanted to make sure I added some context to that, because I think while we all want COVID to go away and everybody to get back to work, this program existed in our community under the advisement of our health department for 40 years, and it wasn't because of COVID. And several people who utilize WIC, they're not unemployed, they're underemployed, and they just need the additional help. And this is an area where I feel like we're responsible to give and provide that additional help.
Thank you, Commissioner Mahoney. I appreciate that. And I wasn't trying to be judgmental. One of my sons has been on the WIC program, he and his children, for a while. They've been on it and off of it over the years. So I do understand the issue of the underemployment. I wasn't trying to be judgmental. I'm trying to ascertain how much did our numbers go up with new people because of their COVID shutdowns and they could not work at all. And so how much could we expect them to reduce once people go back to work? I understand the need for this. My family's on the need for this. I'm not trying to be judgmental. I didn't appreciate that.
Okay.
Okay, if there's no other questions in regard to this one, next slide, please, Rashmi.
Okay, the next one relates to WIC. It's our breastfeeding peer counseling portion that we provide under the WIC program. So we weren't able to make reductions. As you can see, this is all part of the WIC program, and we had already talked about some of those reductions there. This does provide just the support to breastfeeding, assuring that breastfeeding duration can occur for a longer period of time, and how to provide that proper nutrition for the help to have healthy infants. Any questions here? Okay. Next slide, please. Okay, the next slide is our soil erosion program. This one is a non-mandated program. It's a program that we have taken on recently, and we've had some discussions about potentially moving this to the Department of Transportation, and we're needing to have ongoing discussions there with them to assure that. Michelle, can you move on to the next slide for soil erosion, please? So that's essentially what it is for that program. Nothing more to really provide there. We do have fees associated with it, and we're looking to potentially increase some fees, and we'll come with a proposal to you in the future on that. Any questions on that? Okay. Next slide, please. We'll move on to communicable disease prevention. This is one of our mandated programs as well. We receive state funding for it. This includes our tuberculosis program, anything in terms of investigating disease outbreaks. Obviously a big part of what we're doing for COVID right now is included as part of this program. It is a mandated program. We're not able to make any cuts here. We've only got 1.7 FTEs. And so we're not able to eliminate all of that in order to balance this out. So then we wouldn't be addressing any of our communicable disease outbreaks. So we weren't able to achieve any cuts there. Any questions on this? Okay. Moving on to the next slide, please. So for environmental health, we tried to lump these into what's considered, can you go back a slide, please? Okay, for environmental health, it includes our food, private wastewater, and private water supply. Fees were increased in 2019. Some of those, because of COVID, we were able to implement those in 2020, but not all of those. It is expected that we'll see a full fiscal impact of the fee increases in the FY 2021 budget year if things get back to normal. We'll be coming forward with you at the Human Services Committee meeting to be able to look at some fee proposals here shortly for the year 21. So one of the mandated programs here is our food program. We have briefly touched on this about how many licensed establishments there are. As you can see here for our food service program, it's 450 plus or minus licensed establishments per year. We have 16 minimum program requirements that are associated with that under our accreditation program. And part of those I've listed here, they include plan review, making sure those are done in a timely manner, evaluation frequency about twice a year for year round and once a year for seasonal establishments, temporary food inspections, such as operational evaluations of non-licensed operators, and special transitory food operations that request inspections. And then follow-up evaluations, re-inspections for those that have priority and priority foundation violations that are associated with them. There's certain criteria that are associated with those priority violations and priority foundation violations. Staff training, got to assure that our staff keep up to date on what if any changes in the food code law, things like that. And then finally, one of the biggest pieces is the foodborne illness investigations, which relates back to our communicable disease program and being able to respond to foodborne outbreaks in a timely manner and being able to address those. Excuse me, next slide, please. So in the next slide, we've got our mandated services as well. These include our private wastewater. As we had talked about before, that includes about 225 septic systems, 5 minimum program requirements per accreditation that you'll see outlined here. A lot of them related to re-inspections, evaluations, making sure things are up to code, things like that. And then you've got our private water supplies, which accounts for about 270 some systems per average each year. We have 8 minimum program requirements that are included as part of that one, assuring that well and pump records are kept in an accurate manner, in a timely manner, issuing permits, again, doing those inspections and re-inspections as necessary. So we do, as I mentioned, for those 3 programs that I just talked about, food, private wastewater, and private water supply, we get state funding for those, so those are mandated. So we have our state contractual obligations that we're required to meet as part of those. We are reviewed every 3 years as part of the accreditation process, much like in the other mandated programs that we also provide. Next slide, please. So there are a number of non-mandated programs that we also do. Type 2 water supply, campgrounds, pools, septage, and body art. So those are listed here. Those are done, the inspections that are done for these establishments are the same sanitarians that work in the mandated programs as well. So one thing that we're looking at here is to get our 6th sanitarian back for what we used to be at our staffing level once before. And we are proposing to bring fees forward, as I mentioned to you earlier. We're going to bring those forward at a Human Services Committee meeting. And we're hoping that those fees can help to sustain that position and keep that at a level so that we don't have a delay in service. Any questions on the environmental health side?
Yes. Rashmi, I've been following along on the PowerPoint presentation that Mike sent us on Friday in his update. And I think it was originally the same program, but as I look at the numbers on what Mike sent are different than what you have on this PowerPoint. For instance, on this slide, you've got 54,317. And on the exact same slide that Mike sent us on Friday, it's got 99,137. And I've noticed that on a couple of other slides. How did the numbers change, or Mike, if you know?
So, yeah, the reductions that you see in the parentheses, should be the ones that are the reductions for those program areas. So the 54,317 is what would be for the non-mandated program. And then for the mandated ones, it should be 54,317. I think that's what we should be seeing. Cecilia, do you know if there's a discrepancy somewhere, or Jonathan, speak to that?
Well, I'm looking at, go ahead.
The
I'm sorry.
90, no,
That's the question.
you're fine. The $99,000 deficit was before we updated with the additional fees for the wells fees. So the 54,317 deficit is the updated one with the 6 sanitarian and also the increase in the fees that are going to go to committee next week. So it looks like he sent you an outdated PowerPoint.
Yeah, that's the one we got just this past Friday. And so there's $45,000 in fee increases then that you're going to ask for. Is that accurate?
Yeah.
No.
Is that
No.
not the amount,
No.
Don? Do you know what the amount is?
Now, when it all comes down to it, maybe I can help explain this. Over the last few weeks, there's been a lot of numbers going back and forth, trying to figure out what is the true deficit. What is the true deficit based upon the current staffing model, which is I've been basically working with 5 sanitarians and 1.6 clerks since October of last year, trying to actually get that to near full staffing of what we've been used to with our numbers and our workload, which is actually 6 sanitarians and 2 clerks. I'm going to be presenting a staff report that represents a staffing load of 6 sanitarians and 1.9 clerks, and that 0.1 of an FTE clerk, that person will work, a little bit in another health department program as part of his work duties. So when it's all said and done, yes, I raised fees. Well, actually, the Board of Commissioners raised fees last year in the primarily in the food, campground programs, pool programs, DHHS programs. With that increased revenue, the expected revenue from that would bring our revenue side to about $950,000. Okay. We're still essentially $135,000 short. And that's what I'm going to be bringing to the commissioners to get us up to that expense rate that represents 6 sanitarians and 1.9 clerks in the environmental health division. And with covering the indirect costs that's applied to our division.
Mike, this comment is for you. Could we get, well, I was most curious how the numbers changed from August 21st until now in the 2 PowerPoint presentations. So Mike, can we get the updated PowerPoint that has different figures than the one you sent on the 21st?
Well, the one I sent, well, obviously the 21st is 10 days ago. Obviously they've made a change. I've only seen this one change. And Rashmi sent this to Michelle. So this is the latest version.
Yeah, and I'd like that one then if we can get it. And I've noticed, I think there's other numbers that have changed as well.
It'll be on our, we'll add it onto the board docs because we're going through it all so that everybody has access to it.
Thank you.
You're welcome.
Yeah, and the staff report will make it very clear as to what do these numbers represent at what point in time, because that's very critical too.
Any other questions on environmental health? Okay. We'll move to the next
Moving
slide,
on.
please. Okay, this one is HIV Data to Care. It's related to our communicable disease program and our sexual health program. We're required to have to do surveillance for individuals that are HIV diagnosed and link them to care. So we weren't able to make any reductions in this program. It's part of a bigger program. So that's that one right there. Any questions on that? Okay. Next slide, please, is the abstinence program. This is a non-mandated program, and this is for addressing our teen pregnancy rates in our county, which continue to, which have decreased slightly in the past 10 years. But we continue to provide this program as a community service because we recognize that it's one that could definitely keep our costs down in terms of trying to, account for unplanned pregnancies, things like that. There's a required match of $37,500. So we are required to provide that. So that's not as much of a deficit there since we're required to provide that as a match. And then just to provide some information on the economic value of this, each dollar spent on the programs to prevent unintended pregnancy saves taxpayer dollars about an average of $3.78, which is about a 400% return on investment. Any questions as part of this one? This one is a specific evidence-based curriculum that provides about 15 to 16 hours of student education and service learning. That's part of it. Any questions on this?
Rashmi, I do have just one, and I don't necessarily see it here, but don't we have a reducing teen pregnancy program as well? And is that totally separate from this?
We've got a teen that's coming later, Commissioner Elwell. It's a teen pregnancy, teen outreach program that you might be talking about. Is that the one?
Yeah, I think I saw it on another document last week.
Yep. Okay. Yep. We'll be getting to that one shortly.
Thank you.
Mm-hmm.
Rashmi, this is Michelle White. Sorry, if I could also clarify, you will see there are 3 different grants that are referring to teen pregnancy prevention. Commissioner Elwell, I believe the teen reduction, it's got some fancy name here, teen pregnancy reduction, that is our United Way grant. Okay, so that is different. We have 2 separate state grants that are very large that come from the federal government. This is one of them, but the one specific called the teen pregnancy reduction is United Way.
Thank you. Thank you.
Okay, next slide, please. We've got our lead screening and case management. This is done with staff that work in other program areas as well. This is to provide case management for children with high blood levels. We do receive a reimbursement per visit per year, per visit that we do, and we refer to the state lead abatement program if needed. In order to balance this program out, we'd require a reduction of from 0.41 to 0.31. So we wouldn't be able to continue this program any longer. So we would likely reallocate the individuals working in this program to the other ones that they're working in. They work in other program areas throughout in the health department. So
Rashmi, I have a question. This is Phil Buckham. Does this service, it's not being duplicated within the city, is it? I think the city does their own lead water inspections, or do you do that for the city?
no, this is not, the city's not doing case management as far as I know, Commissioner Duckham. This is really more case management. So when kiddos have high lead levels, they are being referred for services as necessary, provided nutrition, education as appropriate, because that helps to reduce the lead levels. And I don't believe the city is offering a program like that to do the case management piece for the kiddos. I think the city's piece, if I'm not mistaken, I believe the city's piece is really more to do on the housing side of things.
Yes, I think so too.
Yeah.
Thank you.
Mm-hmm. Any questions on this? Okay. Next slide, please. So the teen outreach program may be the other one that Commissioner Elwell was also thinking of. This is another program to provide healthy lifestyles and positive mentoring for youth. We serve about 100 youth per year with 500 hours, or excuse me, 50 hours of instructional based services at 7 different sites. And we receive about $100,000 in funding for this. So that provides about 35% of the match that is required to do this program. So it's critical in that it helps to reduce, social issues that might be going on, drug issues, things like that, helping kids to be set up with a positive mentoring system, and decrease in, I should say decrease teen pregnancy there. I don't know why it says increase, excuse me. And it should lead, or if things lead to increased teen pregnancy or increased drug use, I think is what we were trying to say there, if the potential of a program like this not continuing occurs.
Rashmi, if I may ask a question.
Yes.
Doing these programs, and I'm not faulting the programs in any way, but do we have any evidence-based or statistical data that shows we're improving the situation when dealing with these things? And if we do, when does the health department present that as something? Is that something you give at Human Services?
Yeah, I mean, certainly we can see that our teen pregnancy rates are down, and a lot of that is in large part to programs such as this that are offered, but we can certainly provide more detail and information on the true impact of that, at a Human Services meeting. We can definitely do that. Michelle, did you want to add anything real quick to that part in terms of what
Yes,
other?
thank you, Rashmi. So yes, Chairman Shotwell, we do every year track a chart. We have reduced the Jackson County teen pregnancy rate by over 50% in recent years. However, the disparities are still in the city of Jackson. We have racial disparities as well. For African-American females, the rate is 2.5 to 3 times higher. So these grants, the Teen Outreach Program specifically only works with alternative schools. That's why you'll see the number being 100 youth. We work with T.A. Wilson Academy, Pathways, 4th Street Learning Center, and Western Career Prep. So these are some of the greatest at-risk youth in our alternative schools, and that's why the intensity of the program. But I have the data, and we do share that every year. I know sometimes commissioners reach out and want to see those specifically, but I can email that out to Rashmi, and she can share it with Mike to get to you all. But we have, we collect data every year. And we have a website for that, and I can make sure you get that. But we've made great strides. We're just still higher in the city of Jackson, mainly.
Okay. Thanks, Michelle.
So our total teen pregnancy around the county, because we'll stay focused there. I realize that we have an exception within the city boundaries. When do we get to the point of true diminishing returns on that, Rashmi? I look at people hit by cars, and we do everything we can education-wise to tell people not to run in front of moving automobiles, but we still have people get hit by cars.
Right.
When do we reach diminishing returns? When do we look at this and realize that we do have a problem, but there needs to be another alternative put forward, or another outreach program, that actually can impact the areas where we have exceptions?
Yeah, no, and that's a great question. I think part of it, Commissioner Shotwell, is that, you see those long-term impacts being impacted, down the line, whether it's decreased youth violence, decrease in teen pregnancy, decrease in drug use, and unfortunately, those disparities do exist right now. And some of those, you're going to see those long-term impacts, maybe not today, maybe not even 5 years from now, but, you'll see incremental changes over time. But, we can certainly try to find some information on, national level on how programs like this really do sort of impact that on an incremental basis. We can try to put together some information on all of that for you.
I'm just wondering, are we, do we need to get into regular ed schools? Do we need to figure out a way to communicate the program to regular ed and see if we can see, I think back to a time when Dan Hines used to tell us that if there was a reading issue by third grade, we knew that we were going to have trouble with the youth when they reach adolescence and post-adolescence and being with incarceration. So I'm just wondering, do we need to figure out a way to really impact this is it education? Is it keeping the boys and girls in school? Because it's a two-sided problem. We can't constantly blame the girls. And get a strong education for helping to clear this up. And I'm wondering if there's a way we can reach out to the school system. And I realize we won't have any money to put towards this. I understand that. But maybe there's tools that we produce or documents that we produce within the teen outreach program that the school counselors can use, social workers can use to help reach out. And I know that Center for Family Health is directly involved in the schools now. So I'm hoping, maybe there's a flow of information that we need to get going, in the 5th, 6th, and 7th grade, or before that even, to make sure these kids are moving in the right direction, because it'll truly impact all of us if we can avoid this.
Yeah, that's a great point. And yeah, we can certainly look into what we can provide to the we do target really more the at-risk youth, but if there's an opportunity to provide some prevention information there too, we can look into that.
Rashmi, could I add to that as well? Chairman Shotwell. So I've been at the health department for 25 years, and I've worked with these programs since my inception in 1995 when I started. And we do try to follow that model. So the abstinence program, which is now titled Empowering Youth Today, we start as young as 10 years old, and we do have to target Jackson Public Schools. But we do serve 350, and it focuses on puberty education. And that's why it's called Empowering Youth Today. And if you were to see our evidence-based curriculum, it is more about communication and decision-making and involving the families and parent education. And we've been trying to do that, which is why we've had the success. Our United Way funding that we've had since 2006 allows us to work with every single Jackson County school district that teaches sex education. And it's not mandated that they teach sex ed, but the majority do. So we work with their sex ed advisory boards, and we're helping them to start with great puberty education, and then middle school education. Most are abstinence only at the middle school if you are not, continuing up through they graduate. So that is something that we do with the $20,000 we received from the United Way. And we've been doing that since 2006. We did have funding before that from the commissioners from other, it was Healthy Communities funding, and we've had county middle school abstinence education programs in the past with that funding. But it is a philosophy that we do instill, and we do work with, we have a relationship with the ISD and all of the health teachers at every building level. So that is something that's been in place and we believe strongly in. It's just the teen outreach program that is focusing on the alternative, but our other two programs do not. And the teen outreach program, I will say, is only 10% sex education. It focuses on so many other aspects of that individual's life, because, we can teach at-risk kids about, condom usage, all day long, but there's so many other aspects of their life, about where they're going to live, where are they going to eat, and, the kind of family structure that they come from. So it's a very complex issue. And as many of you know, our community has had this teen pregnancy problem for so long. It's usually a symptom of a larger issue happening in the community. And that's what the city of Jackson especially has been facing for a long time.
Okay. All right, we'll move on to our final slide here. And just to let the commissioners know, obviously, about the cuts that we had made last year too, as a result of the budget reductions. We did about $500,000 last year. So we have been operating at a bare bones minimum staffing here for the last year. And as you also know, a lot of our staff has been diverted to COVID response efforts over the last year. So any of these reduction and cuts that I just talked about, any of these programs, you know, we do understand it might be where we would have not the ability to meet some of our minimum program requirements. As I've outlined for you already, and you know, there could be impacts to all of that, as I had already talked about. And then the other piece of that is if we continue to not meet our minimum program requirements, especially in those mandated programs, you know, there's the potential of, are we going to be able to meet accreditation requirements and keep our contractual obligations up? So just wanted to be sure that you understood the consequences of all that if that continues down the road. Any questions, final questions?
I have some final thoughts just for the board. In summary, looking at the spreadsheet there that summarized everything we just saw, as far as the numbers go, at least, I wanted to make sure everyone understood what has transpired over this whole review of the health department and their function and their dollars. They really have looked long and hard at their program. Forgive me, I'm looking at the sheet here. And because they were originally a few $100,000 in excess of the $1 million that the county had proposed, or I should say traditionally transferred, more recent. And we looked at that, and they looked at that, and they were able to par that down so that the reduction in general fund to the program is $200,000. So instead of $1 million general fund to health department, it's $800,000. Well, once we started looking a little more closely, we had realized that the health department had anticipated using some of their fund balance to draw down on that. They have roughly $450,000 in that account. As a general rule, we're trying to avoid every department having hundreds of thousands of dollars in these little savings accounts. After a while, you start looking across the board at the budget, and those things start to add up. And we have a general fund and a general fund policy for the purpose of maintaining liquidity and taking care of those more immediate needs. One moment there, Dave, and I'll jump right to you. So what we did was we said, hey, right now we have this significant need. Can we make the cuts and the pain a little less hurtful, maybe a little more manageable? So what we did was we said, well, we'll move $600,000 from general fund to the health department as opposed to $8. And then they could draw down on their $450 by another $200,000 is how this all translates. So from the county's general fund perspective, they have a $200,000 reduction. But when you look at their reserves, we're going to draw on that and cut. So from the county's perspective, it makes it $400,000, which makes our cuts in other areas a little more manageable this year. As you know, many of the things that is driving our deficit are one-time things. Some of them are hopefully looming to be resolved here, like the SRI, and some of those will be resolved. So hopefully the state revenue sharing will be resolved. I still do not know. I don't know if Cecilia's heard from them since yesterday, but we do not know what the state revenue sharing is going to be, what that reduction is. So FYI, questions? Dave, and then Earl.
Mike, how do we get to where departments of the county have their own fund balance? And how is that then overseen by the Board of Commissioners? And are there other departments of the county that also have their separate fund balance?
There have been historically, yes. We've been working on reducing that for some time now, actually. What happens is you'll budget money to be transferred over to that department. And you're talking non-general fund departments. So, childcare, youth center, FOC, those kind of departments. So when we make a transfer of $1 million and then that year they do not use that full amount, that money remains there. We can't just transfer it back. So
Why
what we
not?
end up doing is budgeting them to spend it the following year. At least that's what we try to do.
Why can we not just transfer it back?
I'm not sure. Cecilia might be able to give a better answer to that, but that's been my understanding since forever.
Well,
Any thoughts, Cecilia?
There's no reason why we can't transfer it back. It's just also easier just to reduce the transfer for the next year too.
Are you sure about that?
Thank
Do a
you,
transfer
Cecilia.
back?
Yeah, I was going to say, thank you, Cecilia, but, all right.
But-
We'll leave it
Well,
at
my
I don't know
position is
why.
that my position is it makes it a little bit difficult. Well, for me anyway, it makes it difficult to track where all that money is, and I think would kind of lose
We
track
agree.
of it. And are there other departments of the county that are in the same situation? And 100,000 here, 100,000 there. Before you know it, you're talking real money.
Yeah, it's the truth. Some departments had, I remember the health department way back when had huge money. Cecilia, do you have a sense of it? I know we've been burning down. It's like the youth center. They don't anticipate using all the money that we gave them this year. So we expect next year to give them less general funds so they can draw down on that reserve they have.
Well, we can continue to talk about it, I hope, but my preference or position would be that I think that it should come back from each department that we can bring it back from. It makes it easier for us to track, especially when we have a fund balance policy of what, 20 or 18 to 24%. Right. Thank you.
Yeah, we're in agreement on that. I believe Earl had a question.
Yep, I was next. So this is probably born out of my comparative newbiness here, Mike, but I do want to understand what the transfer out of the health department is. Last year or current year, it's 900,000. Next year, it's 800,000. I think I understand the transfer in is from general fund, but where's the transfer out going?
Sure. Go ahead, Cecilia, because I assume that's, go ahead,
That's
Cecilia.
it's the Maximus indirect rate for the
Yeah.
health department.
Okay, so this is what the health department is sending basically back to general fund as its share of countywide type
Indirect,
expenses that get
Exactly.
allocated from due to Maximus.
Yeah.
Okay,
Payroll, HR, finance, all those related expenses, IT services, all those kind of things.
okay, I just want to understand that. And I guess
Electric.
I see we've got $148,000 deficit in the health department budget for the coming year. And if nothing changes in the next year, then it's going to be at least that much, it seems to me. I don't know that we've made the kinds of systemic changes that need to be made to balance this budget, but perhaps that's the next year's question.
Well,
Thank
and I think you hit the nail on the head, Earl. That is kind of my thinking, was that would be the next year's question. I frankly do not believe that the health department probably will ever be able to just live on the grants. There's always going to be some contribution just for the MOE that's legally required, as well as the match. I think it was 400 and some thousand, if I recall. So, getting to that is truly the challenge. And I think, again, I think Daniel said it best when he said something to the effect that, these are folks who probably the least able among us. So we were trying to be guarded and very conservative in our thinking on what we can reduce there. But nonetheless, it'll be looked at again next year because they cannot continue to draw on any reserves because those will be gone. Well, they have probably one more year left if we were to go that route, but we'll see. Other questions, concerns, or otherwise before we move on?
Yes.
Tony?
Can you tell me what is the budget deficit projected here? And what is the existing fund balance?
Are you
Well,
looking
Cecilia
at,
can tell you for sure.
right, do you have the document the attachment that was on board document?
I could open it
Yeah,
up right now.
He's got it there.
It's on there. The whole budget is on there.
Yeah, year end and 20 is anticipated to be fund balance is $453,197. And then the 148,000 that Earl had alluded to there is in 21. You can see it reduces their year end anticipation is of 305,000 left. And then if you follow that forward into 22 and draw down on it again, they're down to 132 or 32,000.
I do not personally believe that each department should have their own fund balance. We give them a budget that they need to operate with, and that should be adequate. If they've been saving money and building up their own fund balance, well, then we need to, I believe, give them a budget that's requires them to draw down their fund balance substantially.
That's exactly what we do.
That's what we're working on.
Mm-hmm. Yes, Earl.
I don't want to impair other commissioners from asking questions, but I'm going to keep raising my hand. And this is, I think, a general question for Rashmi and for Mike, and it is whether we receive adequate revenues from other governments that make mandates upon us to perform these services. In other words, do we get enough from the state, or do we get enough from other entities to fulfill something they require us to do as a condition of getting the money? And if the answer is no, I'd be prepared to push back against those who would require us to do something but do not provide the resources to do it. And I don't know if there's an answer for that right now, but I'm kind of curious to know in a longer term whether that's the case.
I can answer that, Mike. So Commissioner Pulaski, I think it really depends when you look within of those 8 mandated programs that are provided by the state, or that are supported by the state, excuse me. You know, I know in Hearing and Vision, there hasn't been an increase in that program for quite some time. There are some other programs that are like that we haven't gotten an increase from the state to keep up with our costs. We did get some additional state funding over the last couple of years, I will say. But, you know, we'd have to look at each of those different programs, you know, one by one to see what really has the state provided over time, and have they been able to support our costs there to any degree. But I know offhand Hearing and Vision has not had an increase in quite some time.
I would add that in general, that is very true, Earl. There's lots of programs. There's even lawsuits about, you know, unfunded mandates. So this is nothing new. They'll give you the minimum, in their mind minimum, and when you get into the reality of it, it's usually not enough. So no, I think that's an ever pressing problem. Other questions, anybody? Just speak up. I don't see anyone. Well, okay. Thank you, Rashmi and Michelle and Don. We would now want to move to the friend of the court. I believe Sarah's on. Sarah, if you could give us just an overview, so especially for some of the newer commissioners, you know, what is it that friend of the court does in brief, and then any anticipated changes or challenges that you see that we should be aware of.
Good morning, commissioners. Okay, so high level overview. Our primary responsibilities are to enforce and investigate domestic relations orders. So those are divorce orders, child support orders, parenting time orders, custody orders, as well as orders that relate to medical expenses and medical insurance. So the typical example of this would be two parents that got divorced or are getting divorced or separated. We would meet with those parties. We would get them entered into a temporary order so that at the initial stages, they would know where the child was staying, who would be responsible for insuring the child for medical insurance, how they would handle the expenses related to childcare, parenting time schedules, who would be making the important decisions related to what school they're going to attend, what school, whether they do homeschooling or virtual schooling in this day and age right now, as well as who would be responsible for the child support obligation for the child, if any. So down the road then, this order would get set up. We would establish protocols for enforcing the orders. So if there were ever any issues relating to legal custody, physical custody, parenting time, so parents that may not have access to their child because the parents aren't getting along or there's a dispute regarding the parenting time schedule, we would be in charge of enforcing that for them or providing them with opportunities to get in front of a judge or a referee so that they could have those issues resolved, as well as providing them with the services to enforce child support. So in some cases, when parties are unwilling to pay their child support, we have enforcement remedies associated with that, as well as on the softer side of that, working with families that, you know, if somebody loses their job and they can't afford their child support, we work with them to modify their child support order or get them job seeking remedies, as well as parenting classes, substance abuse referrals, different remedies and opportunities for them to get themselves back on track. So we aren't just putting people in jail when they don't pay their child support. In short, we do make sure that we work with the families to find out what's going on, what their barriers are to paying their child support, as well as their barriers to accessing their children. So we have many cases where parents have had to leave the state, or they have situations right now with the pandemic where, you know, it might not be safe for the children to go to the other parent because perhaps they are a nurse in the COVID center or have a vulnerable population in their home. So we're working with those families to address that as well. We do have a supervised parenting time program that is grant funded that's in our building. So that is also for our families that are working through domestic violence and suffering that situation with their families. So that offers a safe opportunity for parents to exchange their children or spend time with their children when domestic violence and safety is a huge factor in just being able to access their children. We also offer the Smile and Forget Me Not programs. So those are initial educational programs that are required by the state to help introduce parents to, it's for new divorces, new separations, new orders. So there's a video associated with that that helps parents understand that they need to focus on their children and what they're going through, identify areas where their children may be experiencing stress that they may not recognize, because as many of us know, when you're in the middle of a divorce and a separation, sometimes you lose sight of your children and because you're knee deep in your divorce or your separation. So that's an excellent program to introduce them to the front of the court, as well as put the focus back on the children. Are there any questions about the high level items on that?
Questions, commissioners, about what they do, or if not, or I should say perhaps about the math of the numbers in the budget or anything like that? I believe Corey has his hand up.
Hello. So the things that you just listed and described, are they all mandated by the state?
Yes, everything that we do is mandated.
Okay, thanks.
And the state pays for what, 2/3, right, Sarah?
Yes, we have 2/3 reimbursement. So for every dollar that the county spends, 2/3 of it is reimbursed by the state. So on the flip side of that, when we make cuts, we have to cut 3 times as much to get to that dollar amount because of the reimbursement. We also have federal incentives. So our performance in enforcement of child support, enforcement of the current charge of the child support, as well as the medical, those are all factors on a federal level that we receive revenue for. It's a little bit complex because it comes from a big pie piece that goes to this whole state, and then the state divvies it up to each individual county. So as long as we're doing really good on our performance factors, the money that gets to us, we try to maximize. So, but sometimes you'll find that other counties like Wayne County, who's extremely large, they may not do as well with their performance factors, but they will get a larger chunk of the money because they're a larger county. So we have maxed out on our abilities to get as much revenue as we can at this point.
Thank you. Other questions, commissioners? Well, where we're going here is at our Tuesday night meeting this month. I would anticipate having the public hearing, taking any input from that, and ultimately approving the budget for these two departments. Their budgets are on the state year. They start October 1. That's why generally we try to approve our whole budget in September. That way we don't have to split it up like this. Nonetheless, if you don't have any questions now, if you think of anything or you have a question or concern or otherwise, you're more than welcome to obviously transmit offline to me or to whomever, Rashmi, if you need to. And we'll try to answer them. And of course, if one has a question, we'll respond to everyone so that everyone has the answer. But otherwise, we anticipate bringing this to our meeting in 2 weeks, seeking approval. Any other questions? Phil had his hand.
Mike, where are we at on our budget right now? I mean, we were at 2.7 or 2.3. Where are we at, it looks like?
Okay, we're really 2.8, but now there's a lot of variables in there. One is the SRI. Is that going to get resolved? If it gets resolved, that cuts about $450,000 off annually that we don't have to pay. So we're off the bat, we're down to say 2.4. The state revenue sharing, we budgeted $500,000 reduction in there. If it's 400,000, well, good for yay team. You know, we're 2.3. If it's 600,000, well, not good. We're back up another 100,000. So the state's got to make a decision, I would think, soon, because their budget's going to start here in a month. I would like to think they would telegraph or let us know. At this point, we do not know. So there's another big variable there. As you know, I sent out last week, Wednesday, I believe it was, had a Zoom meeting with all the department heads and elected officials, and we discussed what their budget reductions goal is. And frankly, it's 8%. We're looking for 8%. And that 8% is, of course, in addition to all the cuts that, you have in the health department and some of the other things we're looking at as far as be it healthcare or MSUE and some of those others. They probably half those departments are well on their way to achieving the goal. I know even, I shouldn't say even, but because district court is right there. District court's always been very willing and able to meet the needs of the county as a whole. I know their cut is somewhere just over 300,000. And last I heard, they were already had figured out 200,000 of that. So they're well on their way to working through the problems and the math. And same thing with facilities. They had a cut of about 100,000. They're well on their way. They had a master electrician who's retiring that they won't replace, and looking at some other things there. Same thing with IT. They have our senior GIS employee is going to be retiring. So when you add that and then a few other things, get you to the number. So most departments, or at least half the departments that we've asked, are well on their way to making the reductions. there's some big ones out there that yet we haven't heard from, but we're scheduling meetings to meet with them in the coming weeks. Expectation is for the remainder of the budget later this month. Let's see, our meeting's on the 15th, so like the 21st and maybe the 28th. I think those are Mondays. I was anticipating having some budget discussions, just to focus on the budget where we are, with the idea being that the October 6th, I believe, study session would be a public hearing, obviously discussion of the budget, public hearing for the budget, and with second meeting in October seeking approval. Now, granted, we have November, December, push come to shove. I mean, this is a difficult budget year, a lot of difficult decisions to be made. So it's not like we need to be feeling rushed. We do have, as long as we have a budget in place by January 1, we'll be legal. So, and it balanced, that is, it has to balance.
Thank you. You're doing a good job, Mike. So keep digging, because I don't support defunding our police at all, nor taking away retirees' health insurance.
Those are challenges. Those are significant numbers. 8% of, as you can imagine, of the sheriff's department is a significant number.
Mhm.
Other
Thank
questions?
you, Mike. Thank
You're
you.
welcome. Concerns? I believe Dave, then Tony.
Mike, one of the problems or the holes that we're going to continue to have is from the Raffaelli decision and the delinquent tax revolving fund. Some of us have been talking about those things. For instance, patrol cars have always been bought from that fund. That's another hole that you haven't dealt with yet, correct?
Correct. Not openly. We are hopeful that some of these things, for instance, that we can make the cuts that we're making, and that we will have some other things fall in place where we'll have some excess monies that we can use towards that goal.
Thank you.
Tony?
Do you want discussions right now about the health department and front of the court exclusively, or can I just, or is now an
Well,
appropriate time?
preferably, since we haven't looked at any of the other budget, this would be the one we'd want to focus on. We will have plenty of opportunity for the remainder of the
All right, I'll save that comment for commissioner time then.
Okay. Anyone else? Okay, seeing, hearing none. Commissioner or Chairman Shotwell, would you like to take the lead?
If you'd like.
Sure.
We're at item 7A. Is there any other items to be brought before the group? Hearing none. Michelle, do we have any public comment?
Just Davida Quinn.
Please, Davida.
I'm here.
Go ahead.
You can go ahead and speak if you want.
Okay. Thank you all for all of the comments and looking at the whole budget for the entire county. I understand the importance of having a budget balanced budget and making sure that we have enough for everyone in the entire county. But believe me, the work that we put in and that we do for our community, especially the children that receive the services that we give every day, cutting the budget in the health department in some of those areas is very, very, very crucial to the lives of our children. So I will be looking at the budget as well and commenting in the future about the WIC program and the adolescence program and those programs that impact the lives of the less fortunate, of those who are working to try to just put food on the table for their families. That's all I have. Thank you.
No further public comment.
Thank you. Commissioner comments. Who's first? I know Tony wants to speak. Go ahead, Tony.
That's not, I'm looking at every dollar we can get. So again, this isn't a big dollar item. Back in 2012, due to a tax delinquency problem, the county came in possession of the former Bice property. Savoy Oil has a oil well on that property, and the county has been making revenue, not huge, but so back in 2012, the decision was made to take these oil reserves or oil profits, I'll call them, and allocate them to the Parks Department, which back in 2012, yeah, made sense. 2018, the Parks Department got a millage passed. So Parks funding is coming from millage. So to me, as of January 1, 2018, it was no longer appropriate to give the Savoy oil profits to Parks. I think that needs to now go to general fund. And relative to what was given to Parks, in my opinion, inappropriately, because once you got a millage, that's your budget. You shouldn't be getting more budget than that. So if we take the from January 1, 2018 through, got printed small, through August 2020, that's over $71,000 that was given to them. I'd like to see if there's a mechanism to take that back. They should be operating under their millage, not under the millage plus oil revenues. And so then there's still another 76,000 fund balance in there. So we got a potentially $140,000 there. I would like to take that to be taken into consideration for our overall budget. Put that money into the general fund and see if we can reclaim the last 2 years back from the parks. That's my recommendation.
Question?
Mike, is Chairman Shotwell still there? There we go.
Yes, I am. Go ahead, Phil. Darius was next and then Phil.
Thank you, Mr. Chair. I'll be very brief, but I just wanted just to say that it's obvious that we have some cuts that we need to make, hard decisions that we have to make, but I'm just challenging each commissioner and all department heads that we continue to work together in making these decisions. As I said, we have some hard decisions to make within the next couple of weeks, and so we want to make sure that we can make the necessary decisions that are even across the board and not just targeting in certain areas. So that way we can be able to best serve our communities. We don't want to put ourselves in a position that we're continuing to push the most vulnerable members of our community in an even further position, because then that creates even bigger problems down the road. And then also we don't want to hinder any growth that we've seen amongst the health department, amongst the environmental departments, and areas of work that we've done. So again, we have some challenging decisions, very challenging decisions to make. Let us continue to keep working together and making sure that anything that we do, that we're working evenly across the board, so that we can so that we can just continue to move forward with the progression which we've made so far. Thank you, Mr. Chair. I have nothing further.
Phil?
Question for Mike. Mike, years ago, when we formed the Land Bank Authority, we gave them $100,000 seed money to operate with. Has that come back to our general budget yet, general fund?
I believe that has.
Okay, because it's Land Bank's pretty inactive right now. Thank you.
Welcome.
Corey?
I just wanted to bring up we got an idea in the email from Commissioner Bear. I think he had asked if any had any ideas on that to send that to Mr. Overton, which I did. I would be fine not taking any type of travel budget and leaving that money in the general fund. I would hope the other 8 commissioners would consider it, considering the time of year, the type of budget situation we're in. In addition, I had brought up another small incremental thing in regards to immunizations and being a slight fee to that to try to generate a little bit of revenue. I don't know if any consideration was ever taken into that. And then lastly, I know we are entitled to, by law, to take transportation costs as well as being paid for the meetings outside of these that we go to. I would also hope that all the commissioners would consider not taking them in 2021 to help share some of the burden of the budget. Thank you.
Further commissioners? With that, I guess I'll entertain a motion to adjourn. Moved by Phil, supported by Rodney. All in favor, show the sign or say aye. Aye.
Aye.
We are done. See everybody next Tuesday.